As we all know, we've just passed the sad marker of 500,000 dead from COVID in the US and hundreds of thousands of others dead around the world, not to mention the millions who have gotten sick. Unemployment is still crushing people, leaving people to wait in food lines just to survive. Big Pharma, meanwhile, is making money hand over fist on this calamity, as it does each and every day. Now check this out. Hundreds of thousands of more people may die globally, maybe millions, and the economy may be damaged for a long time because of Big Pharma's control over the patent rights of COVID-19 vaccines all around the world. So here's the story. Under the World Trade Organization rules, Big Pharma gets lengthy monopoly protections for medicines, tests, and the technologies used to produce them. That's one reason people oppose these bad trade rules for many years. These trade deals, which we were sold with the marketing phrase free trade, have nothing to do with the theory of free trade. It's the exact opposite. It's not free trade. It's very much controlled trade, controlled for the profits of big corporations like Big Pharma. These deals set up massive lists of rules that allow corporations to control money, capital, and in this case, patents to make piles of money at our expense. Now, poor countries can't afford the prices under these patented vaccine protections, so it's likely that tens of millions of people won't get access to a COVID vaccine, perhaps into 2024 around the world, which will mean A, lots more death and sickness, B, the further spreading of these variants globally because the more the virus spreads, the more it will mutate, and C, trillions of dollars more in economic damage. Yeah, if you don't care about the morality of death and illness, letting Big Pharma just control this vaccine will mean economies can't open up. The recovery globally will take much longer, and more anguish and economic devastation is the game here. Here's a number I just saw in a January issue of The Economist. The cost of the COVID-19 pandemic last year and this coming year will probably total $10 trillion in goods and services that were not produced because of the pandemic. That's a lot of lost futures, lots of broken dreams, and misery for millions of people. But bingo, there's a simple solution. Over 100 countries have called for a temporary waiver of these so-called, and here's a mouthful, trade-related intellectual property rights, that's the acronym TRIPS, on the technologies that are needed to produce more COVID-19 vaccines and medications. Now, that waiver, surprise, was blocked by the Trump administration, one of the very few governments to block this emergency waiver, which would let poor countries have access to the vaccine. Now, next week, Joe Biden can direct the U.S. to allow this waiver at the WTO, at the World Trade Organization. And if the U.S. supports the waiver, it will almost certainly happen. Big Pharma will be furious, of course, which means campaign donors will be unhappy. So the pressure has to be brought to bear from us. On the front lines of this fight are two warriors for progressives. Representative Jan Schakowsky, who has represented the 9th Congressional District in Illinois for 2 decades, and Lori Wallach, the director of Global Trade Watch. And we're lucky to have both of them now to tell us about this urgent effort. So, Congresswoman Schakowsky, you've been around these trade debates for a very long time, and you've been an important advocate for fair trade, and you've been an ally of organized labor, consumer groups. And what struck me in reading this issue about the COVID vaccine is the hypocrisy, the gross hypocrisy. I know this isn't shocking in this world of hypocrisy and globalists, but the fact that they always like to talk about open trade, free trade, making sure that everybody's interconnected, when in fact, what is happening here with the vaccine, with the COVID vaccine, is they are essentially blocking out, unless we can get this waiver, they're blocking out half the world, right?
That's exactly right. And this is a really, really dangerous move. And it's not just about whether or not poor countries should be able to manufacture their own vaccines. It is about our own life and safety, and that, quite frankly, of humanity around the world. Because if we are not all safe now from the virus, then we are all in danger. And the only way to get out of it is for everyone to have affordable accessibility to these drugs. Not only have I been involved in the issue of trade, but I've also been very, very involved in affordable medications, affordable pharmaceuticals. And this is not a surprise whatsoever. You know, we saw that Big Pharma tried to get into our Canada, Mexico, US trade agreement, a provision that would have given them on their biologics, a certain kind of drugs, a 10-year exclusivity so that they could raise the prices throughout the hemisphere. But this now is throughout the planet, really. And the United States, sadly, unforgivably, really, is standing in the way of making sure that a proposal to allow these poor countries to be able to manufacture drugs temporarily during the pandemic and make sure everyone would have access. The United States is the roadblock to that right now. It's shocking.
And I'll follow up with one other question before we turn to Lori. You're on the budget committee, not to mention a member of Congress. I mean, the United States underwrote much of the development of the vaccines by giving out billions of dollars to these big pharmaceutical companies.
Yes, well, we are definitely stakeholders. We, the taxpayers, have invested a lot of money in these drugs, something they don't like to acknowledge because the big pharmas, these companies are likely to say, you know, we need to charge so much money. Yes, some people die because they can't afford their drugs, but we need to because of the research and development. Well, the fact of the matter is that the US taxpayers are very large contributors through our tax dollars to the research and development on these drugs that they then turn around and make gazillions on and charge what they want and put people in danger.
And so, Lori, you are probably one of the global experts on this whole issue of the waivers, the agreements, the barriers, the regulations. So give us a taste of what this is about, meaning not to get too technical, but to explain to a lay audience what the barrier is here and what we're trying to accomplish. What are these countries asking for?
So the barrier is that one of the 24 agreements that the World Trade Organization strongly enforces on all of its signatory countries, of which there are over 160, is an agreement called the Agreement on Trade-Related Aspects of Intellectual Property, also known as...
I love the way that sounds. That sounds so exciting and makes me shiver.
Also known as the TRIPS Agreement, my wiseacre friend. And the TRIPS Agreement is the kind of thing, as you insinuated, that would make the philosophers of free trade, the David Ricardos and Adam Smiths, roll in their graves. It is protectionism for big pharma with a requirement that every single WTO country provide monopoly protections for pharmaceutical corporations with respect to the patents, the know-how, the technology around medicines. And that's the background. The idea for this emergency is given you've got those handcuffs for big pharma on access to affordable medicines cooked into a so-called free trade agreement. We now have a global pandemic health emergency. And at this point, as the Congresswoman so accurately described, none of us will be safe. If any place on the planet there are outbreaks where mutations can be cooking, that can come back with a zombie variant that goes right around the vaccinations we've had. We can be 100% vaccinated in the US, and because other parts of the world have raging COVID, a variant can develop that will undo everything we've achieved with respect to immunity in any country that has vaccines. So literally no one is safe until everyone is safe. And so the request is to waive those intellectual property monopolies temporarily on an emergency basis, just to the extent that they are needed for people around the world to get COVID vaccines, treatments, and diagnostic tests. And as the Congresswoman said, with this barrier in place, we are not going to have enough of any of that being produced, so that the latest reports are people in developing countries may not get vaccines until 2024. That will doom us all. The only good news is we've got Congresswoman Jan Schakowsky on the case, because, ladies and gentlemen, this is the lady who basically got the really boneheaded Big Pharma boondoggles out of the new NAFTA. So I feel inspired and hopeful. We're going to have to get the U.S. to change positions, but I would like to be marching into that battle behind no one else but Field General Schakowsky.
Well, thank you. And I could not let it pass if I need you, Lori, because you really do know all the facts and all the arguments and can articulate them. But I also want to say this. It's really a dumb move on the part of the United States. We are spending and investing billions of dollars to lift up the hospitality industry, travel. We are spending billions of dollars on the airlines because we want people to come to the United States of America. That will be absolutely impossible to have any foreign visitors if this pandemic gets further out of control, because we will prevent them from having the preventatives, which are the vaccines, at a reasonable price. So we're spending money against ourselves right now if we don't agree to this waiver. I don't know to the extent, and maybe you do, Lori, that the Biden administration has an opportunity to be looking at that and what we can do to make sure that the, what the consequences can be.
Well, speaking as a regular citizen, I'm glad that we have both of you on the case, because you're both great warriors for progressive values. And on that point, Congresswoman, that you just made, and what Lori said, and both of you maybe can speak to this, even if you don't care about the millions of people who might die because they won't get the vaccine in time, to the Congresswoman's point about the economy here, if you look also globally, because we are interdependent and because of the stretching of the global supply chains throughout the world, if the folks in various countries can't open up their economies, then where are the goods going to come from that people want to buy here? I mean, we are interdependent just from an economic standpoint, putting aside the morality of it, right?
I think it's a powerful argument that we need to make to the Biden administration, which has a few things on its plate. I'm in the middle of this this hearing that is going on right now, and we hope to pass the American Rescue Plan, of course, in due course, and that would be hopefully in days. But we need to focus on this. If the president talks about crushing the virus, this is part of crushing the virus. And we've just come off of an administration that was completely isolationist in the most devastating way, devastating to our own people as well as the rest of the world. And now we have to move in a different direction. And I think we need to move quickly. As Lori said, while all of these other viruses are developing, we need to move now to inoculate people.
Do you want to comment on that, Lori, on the economic point?
Yeah, two things on the economics. First of all, I just wanted to underscore what the Congresswoman said, which is how boneheaded is it that we have spent literally billions investing in giving the money and the research to these pharmaceutical companies to be able to develop the vaccine. Then we've paid for the trials. Then we've put billions more into pre-ordering hundreds of millions of doses of the vaccine, so that there is no risk, there is no investment. The fact that they still have a monopoly right to decide how much and where any of it is made is, a criminal element of the over monopoly protection under current intellectual property rules of these kinds of products. So just to start with, we're paid up. The public has paid up. So it shouldn't even be a battle about, particularly with the vaccines, whether those should be publicly available. But number two, of all places, the International Chamber of Commerce published a study last week that said up to $9 trillion in economic damage will be wrought on the world if the scenario of the rich countries being fully vaccinated and the poor countries being largely not vaccinated continues. Because what that will mean is practically just what Congresswoman Schakowsky said. So the US not only is so globally integrated, Jonathan, as you said, but also all of the industries she mentioned, travel, tourism. We are such a services-oriented economy. To the extent that these outbreaks are going on, everyone needs to say shut down. And so that is going to, in that study, $9 trillion of it, $7 trillion they expect to be in the rich countries. So it is economically devastating. And then what's up with the Biden administration? My personal theory of the case is that they inherited an entire football field of flaming dumpsters. And so our mission as activists is, amongst all the flaming dumpsters, we have to get this particularly radioactive flaming dumpster pushed into the front row of flaming dumpsters, because they have so much stuff that they have to deal with. So as activists and citizens, we just need to make sure that everyone understands, our other members of Congress, the president, that in fact, this needs to be taken care of. And it's an easy thing. Just today, the least developed country bloc, which is like 45 countries, just joined the Africa group, which announced it this morning, and they're all officially now sponsoring the waiver proposal that South Africa and India have put forward. It's a very easy fix if the US will just stop blocking it.
And we've been here before when the rights of the pharmaceutical companies ran over the right of people to get cures for HIV/AIDS. We saw it spread across Africa. And shame on us for allowing something like this in a much larger scale, in fact, to happen again. The whole issue of the intellectual property rights and the profits over people's lives is something that we really have to, and hopefully in this administration, are going to have to deal with it. But every single one of our lives right now is at stake in this decision. And so Lori is right. We need to organize around this. We need to make it a priority. We need the administration and all its parts to understand the consequences, the waste of money and lives. And if we really want our economy to flourish and to stop the nearly 500,000 people now that are dead in the United States alone, and the millions and millions of people around the globe who have died, are dying, will die if we don't do something about it. And so this is an immediate, demanding crisis that has to be addressed.
And so to wrap up our conversation, I really thank you both for your time. Is there something that Congress could do if we take Lori's imagery that the Biden administration has inherited all these flaming dumpsters and their focus, for example, on the $1.9 trillion stimulus bill, a whole other set of things? Is there something that Congress can do to move this along, either legislate it or essentially force the issue?
That's it. Well, if you're asking Lori, let me just say that we have drafted a letter to the president that we want signed by as many members of Congress as we can, to make it a priority for him when he sees that so many people have decided that this is really important. So that's one of the things that we're doing.
And I assume, Lori, that you could, in theory, mobilize not just the activist community, but from your previous answer, you would think that a large portion of the business community would be on board. They might not want to get in the face of Big Pharma, but to your point, this is not helpful to big business to look at the rest of the world suffering from the pandemic and not being able to reopen.
So the good news is that this is not something that Congress has to do. So you don't need the House and the Senate to both pass something. Basically, we just need the president to decide to prioritize this and take an action. And it's going to be just as simple as the US reversing its block right now on a waiver proposal that can otherwise get negotiated out and adopted in Geneva at the World Trade Organization. The next big decision point is the 1st and 2nd of March. It's a general council meeting of the WTO. That is the moment of truth. There won't be another of those high-level meetings for another 2 months, so we have ourselves a week. And I want to underscore the importance, everyone who's listening to this, you should make sure your member of the House of Representatives is on Congresswoman Schakowsky's letter. Her letter is providing a great public service of just making clear to the president that Democrats in Congress support this. So yes, your party, your friends, your allies in Congress, Mr. President, are asking you, are waving and pointing at this flaming dumpster to say, please take care of this one right away. And you can make sure your members of Congress know it's very simple. You can call up the switchboard, 202-225-3121. That's the House switchboard, 202-225-3121. A lot of offices don't have a lot of staff. Leave a message, explain what you want. I want to make sure you have joined Congresswoman Schakowsky's letter supporting the TRIPS waiver at the WTO to get COVID medicines to all. Number 2 thing you can do, tweet at your member of Congress. If you're a tweeter, not a caller, just tweet. Same thing, please. Can you join Congresswoman Schakowsky's letter, making sure the whole world can get access to COVID medicine technology? TRIPS waiver now. And the third thing that you can do, if you really want to get adventurous, send an email. Send an email. Every member of Congress, go to their websites. They have emails that you can send in as a constituent, just so other members of Congress know to get on Congresswoman Schakowsky's letter and that you expect them to help all of us stay safe. Because again, we're all at risk until there's enough vaccine and treatment and testing to go around the whole world.
Well, thank you both for being on the show. This was really a wonderful, important topic, and for sure we'll do an update and we'll circle back with both of you. And I think that people feel very secure that both of you are out there as warriors for the people. Thanks for being on the show.
Thank you so much. It is people over profits.